Hello, everybody. It's really an inspiring gathering. To start with, Mayor Bradley from Sarnia, who's a hero of mine for not just these issues, but around occupational disease, especially asbestos, and Mike Lake and the journey that he and his family have been on. And there's a real feeling we got from the policy roundtable yesterday. Things are opening up here. This really could be a historic moment. And here we are all together. And I am so impressed by the research work that's already been presented. You know, you got 60 seconds worth of it from all these young people who are putting together fantastic, thoughtful presentations. And you just get a sense of what research can do to help inform and support transformation. So my job is to bring the coordination discussion down to earth a little bit through the lens of taking one program and then looking out to see some immediate opportunities for coordination and cooperation to the benefit of persons with disabilities, and hopefully that'll open up some other issues. And I know we've had some time, so you're going to give me a 5-minute notice or something? Okay. So I think what I'll do is not put too much into the first part, which is an outline of workers' compensation. My intention was to show the deep roots of these programs, how important they are to populations, to working people in this particular case, and also employers. And you can see why people would want to hang on to this. It took a lot of struggle to win it. And therefore, you've got rooted interests in all kinds of programs that really you've got to listen to and understand the value of the program. And coordination is not just a matter of mashing everything together and we'll see what comes out the other end. But I won't put too much into that. I'll focus on challenges and opportunities. So here we are, the 100th anniversary of workers' compensation in Canada, 2015. And important to remember on this program, workers gave up their right to sue their employers to get these benefits. It's not a traditional social program in that sense. So injured workers have every right to assume they will be made whole by this program. I've outlined the so-called Meredith principles, which, broadly speaking, govern workers' compensation in Canada. And for those who know the US scene, they do not govern the scene in the United States. You get hurt there, your first thought is, what lawyer do I go to? And he or she is going to take 30% of whatever I manage to get. And that's how the system works. It's privatized by and large. So we've got a deep-rooted public sector remedial legislation here, and important, again, thinking coordination to remember that. So I'll skip through. Most of you will have probably seen Meredith principles in the past. I've also reviewed the types of benefits, and here it's to sort of just give a snapshot that you can take. If you took any one of the programs John has, you could do this review. Different kinds of benefits based on different things, with different kinds of time limits to them, complexities around the services available to people, complexities around other aspects that might keep them attached to a program when you might not even understand why. So here it's important to see the power of this program starts that it's based in the workplace. Everybody who gets workers' comp started off as a worker somewhere. They've got a workplace attachment, and we saw with Mike's presentation, in fact both Mike's presentation, some of our challenges in this room here, how do we help people who have no workplace attachment? So that is a benefit injured workers have. And remember also, survivors are paid for as well. People who've lost a loved one to a traumatic injury or occupational disease. Now here, different from some other programs, some health care is paid for and some isn't. And you can see that that could be a real problem for people who have multiple health conditions. Another interesting aspect, workers' comp combines shorter and longer term claims, less serious injuries with much more serious injuries. A lot of the other programs tend to be more the serious injury or serious disability over a long period of time. This means that a lot of what workers' comp programs are doing is more front-end, quick turnaround, etc. Sometimes the workplace parties resolve everything without any involvement at all, hardly. A link here that's very important for workers' compensation is experience rating. There are people in this room, I'm looking down at one table in particular, probably world experts on everything that's wrong with experience rating and the incentives it provides to suppress claims. So it's a good example of a system where there are incentives and penalties which are way beyond design issues, in a sense, that folks up here are thinking about in coordination. So we have interests that are in play and reasons that someone might, as an employer perhaps, want to not have a claim made. And that starts playing into the mix. And I'm also mentioning as the last point, and an underused one in this case, workers' compensation in Ontario is separate from prevention. In other provinces, the workers' comp system is together with prevention. And there are a lot of links that come into this. Think about someone gets hurt and the need to help keep other workers from getting the same injury, the need to protect that worker when they return to work, the need to protect someone with a special susceptibility or disability from getting hurt at work. All these things can benefit from expertise in prevention, and as you'll see later in opportunities, I focus on that a little bit. I'm going to focus in on the three main programs in Ontario. I don't mean to leave out other ones. I know there are others, such as EI sick benefits, but these are the ones that the long-term injured worker will primarily potentially deal with. As John has said, income support levels, eligibility criteria, processes differ greatly. And in Ontario, another complication is that the entry point to ODSP, which is a long-term disability program primarily, is through a shorter-term program called Ontario Works, which is municipally administered. And this has posed some issues around coordination and partnership, which are sort of about the design of delivery. It's not uncommon for people to end up with more than one program, either at the same time or one after another. And I want to add the human dimension here. I mentioned everybody starts as a worker, some very high paid. The decline from being in that state to potentially considering ODSP is an enormous decline. It can be in the realm of your income being cut by 70–80%. Some provinces, at least one, Manitoba, don't have a cap on covered earnings. We could have somebody in Manitoba, as I understand it, who could be earning $150,000 a year and get benefits based on that. But let's say they lose those benefits. Where do they end up? So we're dealing at OWA, and out here a lot of folks in the audience are dealing, whether you're at the board, you're a worker advocate or an employer, you're dealing with people who are suffering a tremendous decline in status, in security, in financial well-being, and all the crises that come with that. And I have to say, the coordination among the programs is lacking at this point in time. There's some great local partnerships that we've been part of that probably paved the way for some improvements on a systemic basis, but we see very regularly people who are more or less cut off one program and given a little bit of information, someplace to go, and literally they start all over again. And they've lost their housing, and they have no money, and the health care they were provided is gone, et cetera, et cetera, et cetera. So everyone's a real person and often suffering. Financial arrangements. Real complexities here, and it's something I don't think John got into too much, but all the sort of back and forth of who reimburses whom, what forms you have to sign, someone forgets, they get paid, they get overpaid. There's a whole sort of a level of that has nothing to do with program coordination per se. It's just another level, and you can imagine if on top of losing your job, losing your housing, and perhaps your family, on top of that someone tells you you've been overpaid, and guess what, your benefits are being cut. So there are sort of details that only insiders tend to know about, which can be incredibly frustrating and harmful, let's face it. I'll add the health professions. It's interesting, it hasn't been mentioned too much up till now, but I'd say one of the very main issues that we face at OWA, and certainly as worker advocates in general, is the growing disengagement and alienation of health professionals from everything we're doing. They don't understand why we have all these systems. They don't understand why they have to fill in a different form for every program. And it's really easy for them to get confused about what they need to be focusing on. If you can imagine, even for the same person. Perhaps one program wants them to say, well, they can work, and another program wants them to say they can't. So literally with the same patient, different issues arise. So a lot of health professionals don't want to get involved, and I've got my 5-minute warning. So I'll zip through, I think. Just add that mental health issues are often now accompanying physical issues, and unfortunately some develop through the experience of the recipient with the system. Here are some coordination opportunities. Improved data collection. I don't think we know how many people with different types of impairments are unemployed in Canada. Literally. How are we doing with people who have visual impairment? How are we doing with people with mental health issues? I don't believe we know. That's unbelievable for something with a multi-billion-dollar impact. So data collection, very important. It would be a good start. Improved information sharing and referral protocols, as simple as, with the worker's consent, giving their medical file to ODSP straight from WSIB on a fast-track adjudication process that should take maybe just 1 day. Think about someone with terminal cancer. They're probably completely impaired. Better mechanisms on the individual cases. We often reinvent the wheel, and I'd really like to see best practices, toolkits, all kinds of things to help us resolve individual case problems. And now, a little bit more visionary. Collaboration on employment initiatives. This is an actual case that happened. Worker gets injured, worker gets recognized claim, WSIB deals with the employer, trying to get the worker back to work, claim is denied, and of course the WSIB can't stay involved anymore. And of course what we want is perhaps them to consider staying involved, charge back the money to whoever you have to, but you're engaged with that workplace, you're helping them, this is their best chance to land on their feet again. We could do a lot of collaboration around how to work best with health professionals and understand their needs and meet them. I've got some case studies, you can look at them when the presentations come. They're just variations on a theme. The big vision, well, I was inspired by Mike Bradley, and I really think stakeholders and leaders in civil society must get together now. Mike said now, I'm saying now, to show how big this problem is, to show how much we can do, to get ourselves out of our silos and really build a movement to include and employ a lot more people with disabilities. Just start now. I am really a supporter, as are some in the audience, of a backpack of supports. I think it is a travesty that an already seriously suffering person is worrying about whether they'll have their medication, their scooter, other assistive devices, travel allowances, all these things they need to function. And we cannot figure out in Canada how to give those folks a backpack that goes with them everywhere they go so they can get their life back together. I'm a believer in joint return to work committees. I've been part of establishing quite a few of them now in Ontario. They're mostly used for injured workers getting back to work. I'd like to see them used for helping persons with disabilities get into a workplace in the first place. And those are just a few ideas. Obviously, they go beyond simple coordination. There's passion in my voice because I've just seen too many people. I don't want to even think of who's in a welfare hotel right now in Toronto, who's lost 2 legs, lost their family. The benefits are now being split between the recipient and the family, as is understandable. And that worker who lost legs at work is in a welfare hotel living a miserable life, and well, we're sitting here. And maybe that worker's out on the street somewhere and you'll see them on your way to Union Station. So think about that as we address this. These are real lives going down the drain, and we can do so much better in Canada. Thank you.